I'm an orthopedic surgeon. I do sports medicine, so I deal with donor tissue almost every week. I do about 75 anterior cruciate ligament reconstructions a year. About 95% of those are using donor tissues. The reason why I use donor tissues is the sterilization techniques that we have now don't compromise the tissue, whereas 10 years ago or so they did. So the donor tissues that we use are just as strong, if not stronger, than using the patient's own tissues. When you use a patient's own tissues, obviously you're taking something from that person's body and causing further damage to their body. So if you use a donor tissue, the person doesn't have to recover from that additional damage post-operatively, so the recovery is much easier, much less painful, and I think you get the results are just as good. So that's one area. I use them in the shoulder for shoulder reconstructions. We use tissue grafts. I just had a girl 3 weeks ago or so that was 28 years old that had a huge defect in her knee, in her cartilage in her knee, and basically was on crutches, had pain all the time, couldn't even walk, and you have a 28-year-old girl whose life is ruined because she doesn't have any function. I was able to take a donor graft of bone and cartilage, take out the diseased part of her knee, and put in this donor bone and cartilage. Once that heals, she has a 95% chance of returning to normal function without any pain. So those are just a few examples. I mean, every week I use several different tissue grafts for different things. In trauma, we use it constantly for bone grafts for big, for difficult fractures. We use it for rebuilding ligaments in the knee all the time. So I'm able to return people to normal lifestyles and normal function that would otherwise have lifelong disabilities if tissue grafts weren't available. So for me, I've always very much appreciated the fact that I've had the availability of these tissue grafts. So I kind of feel like I've come full circle. I'm not only using them all the time, but now I'm a personal benefit of receiving donor tissue as well. So all around, I've always been a donor, on my card, on my license. So I feel very strongly about it. And for me, I couldn't function in my job if I didn't have it. So. It's been wonderful. I mean, the people have been wonderful, and I wake up every day just thrilled to death that I'm still alive and that I have the life that I do. And I think gift of life is part of it, and I want to give back at this point, and that's why I want to try to go out and do talks and recruit more donors and increase the awareness of how important this is for people like myself and just people everywhere, because it's whether you're receiving a tissue graft that improves your quality of life or whether you're receiving an organ that saves your life. I mean, it's still you're improving people's lives every single day, and it's just wonderful.